This first cycle is really going to be a special group, right? And we're really looking for trailblazers. Our first several classes of residents are really going to have the chance to shape what this program looks like and shape that culture.
We really need to have people who will be open to new ideas, new ways of doing things, having a vision of where they think things ought to be.
We are going to cover the breadth of family medicine, everything from cardiology to reproductive health to neurology and surgery and everything in between. That would let them, go into a rural community anywhere in the country and be able to provide comprehensive medical care to all ages.
We're trying to have a strong emphasis on going more towards independent learning, right? And helping residents craft an educational experience that's going to help them be prepared for the specific career that they want. There's not other residency programs, there's not other trainees here that are competing for learning experiences, and so our residents can really be everywhere in the hospital, both learning from, wonderful family physician faculty, but also specialists in all different areas.
I love teaching. I have done it for quite some time now. It is one of my favorite things to do, where I'm really coaching people, watching them interact with patients, watching them do procedures, and then coaching them in that.
Being part of the larger Dartmouth system allows you to have access to some of the extra specialization which you would not find in a community hospital, but you find within a health system.
Our training program is based out of Cheshire Medical Center as opposed to Dartmouth Hitchcock Medical Center because of all the benefits that come from training primary care doctors in a community hospital setting.
Cheshire Medical Center has always played a huge role in this community. We are the community hospital where everyone goes.
Cheshire is a really special place with a lot of special people. It's a very supportive environment. A lot of people really care about what they're doing, about their patients, about their community.
This is a really special place to both work, but to live as well. We have the beauty of Mount Monadnock, we have the Connecticut River, we have kind of in every direction, there's unique things for people to do.
We're 2 hours from the ocean, we're 2 hours from the Whites, we're 2 hours from Boston.
I grew up in Massachusetts, so the opportunity to come back to New England was really exciting for me. It's just a very family-friendly area. I have young children who are in the school system. The school system's been amazing. It's a place where there's always something community-wise going on, a farmer's market or the snow and ice festival. There's always something going on over the weekends.
Keene is almost like the perfect training environment. A city of 23,000 presents a lot of opportunities that you might miss out on in either bigger communities or smaller communities. We're lucky today to be talking inside our new clinical space that's going to serve as both our outpatient clinic, our kind of clinical home, but also our administrative and educational home. We were able to craft a space that really prioritized both outstanding patient care and a really strong educational experience.
We're going to be providing integrated behavioral health here in the new clinic. During a regular patient's appointment with their primary care physician, I can sit with a resident and do shared care, listening to the patient, figuring out how to get out of their way so that they can move forward towards their goal of living their best life and having good health.
We're going to have some close ties with the women's health services that are already existing at Keene through the midwifery program and through the OB-GYNs that are already here.
We really want to integrate a strong focus on care for LGBTQ plus populations, particularly in rural areas that can be a group that's really underserved.
We want to create a program that genuinely is inclusive and is genuinely a safe learning environment where you're going to have the opportunity to ask questions and make some mistakes and learn from those mistakes.
The intern year is really hard. I think it's the hardest year of someone's medical training. You're not in this alone. There will always be faculty, not only myself, but all of the faculty will be here for you to get support when it's hard. I've had residents call me in the middle of the night, which is always going to be an open phone call, and I know that that's true for our faculty too, that if you are really struggling, we would be here for you. This is training, and this is a time of learning, and this program is going to support you through that process.
Within family medicine, I really like the continuity of care, not only getting to know the person, but I know grandparents, their children, their grandchildren.
Being in a rural setting, I have gotten to know my patients so well. Those are my neighbors. Those are the people that I live with. And it's this wonderful sense of community and taking care of your community that I think is really special here at Cheshire and makes you want to stay.
So the thing I would tell any prospective resident who's looking at residency options and looking at our residency is come be part of something that we're building. Your input is going to be, you're right in the middle of it.
What I'm most excited about with the new program is the ability to just build things from scratch. How do we build a program from the ground up, and how do we use that to then train the next generation of family doctors?